What if I told you that some of the medical tests recommended to seniors over 60 might actually do more harm than good? I know that sounds strange. As a doctor who's been practicing for nearly 4 decades, I was once taught that more tests meant better care. But after watching hundreds of seniors over 60 walk through that system, and sometimes walk out with less strength, less clarity, and less peace, I began to ask myself, are we really helping? One recent study published in JAMA Internal Medicine showed that nearly 1 in 3 adults over 70 received at least one unnecessary screening test each year, tests that didn't improve outcomes, but often led to invasive procedures, stress, or serious side effects. If you're a senior or caring for someone after 60, I want to speak to your wisdom, not your fear. Because real healthcare after 60 isn't about chasing every possible problem. It's about protecting what matters most: your clarity, your comfort, and your independence. The trap of endless scanning. There's something almost seductive about full body scans. The idea that a machine can peer inside you, head to toe, and catch every threat before it strikes feels like smart prevention. Especially for seniors over 60 who just want to stay one step ahead. But here's the truth, especially after 70, these scans often uncover more shadows than solutions. CT and MRI scans are incredibly sensitive. They see everything. And I mean everything. Tiny spots on your lungs, a small cyst on your kidney, or a little thickening in your liver. These things sound scary, but most of them would have never harmed you. Still, the fear they create? That's very real. Take Barbara, 78. No symptoms. Active. Happy. She went for a discounted full body scan at her church's health fair. The scan found a small lesion on her liver. That word, lesion, sent her down a road of blood tests, ultrasounds, and eventually, a biopsy that left her bruised and frightened. In the end, harmless. It's called overdiagnosis, detecting something that never needed treatment. But the cost isn't just physical, it's emotional, psychological, and yes, financial. Most full body scans aren't even covered by Medicare or private insurance unless you have symptoms. According to the U.S. Preventive Services Task Force, routine whole body scans in asymptomatic seniors lead to a high rate of false positives, up to 40% in some studies, often resulting in unnecessary procedures and follow-up appointments that drain more than just your wallet. After 60, and especially after 70, real health doesn't come from finding every what if. It comes from knowing what to let go of, what to trust, and when to say, I feel good. That's enough. Colon cancer. Just the name is enough to make most seniors over 60 pause. That's why colonoscopies are often seen as essential, even heroic. But what if I told you that for many seniors after 70, this so-called life-saving test can sometimes do more harm than good? Colonoscopies are invasive. They require full bowel cleansing, powerful sedatives, and inserting a long scope deep into the intestines. That's already a challenge for someone in their 40s or 50 seconds. But for someone over 70, the risks rise quickly and quietly. The bowel prep alone can lead to severe dehydration and electrolyte imbalance. The sedatives, which younger bodies clear easily, linger in older adults, causing confusion, dizziness, and even falls. I once treated a patient, Eileen, 78. She had no symptoms. She'd had 2 clean colonoscopies in her 60s and early 70s. But her doctor suggested just one more. During the procedure, her colon was accidentally perforated. She needed emergency surgery and spent 3 weeks in the hospital. She survived, but she never fully bounced back. Her energy never returned. Her independence slipped away. And here's the hard truth. Most polyps found in seniors grow so slowly that they wouldn't cause problems for 10 or even 15 years. But for someone in their 70s or 80 seconds, that timeline may never come into play. So why put your body, your brain, your spirit through something so taxing? Today, we have safer, non-invasive stool tests like FIT or Cologuard that can screen for colon cancer without sedation or prep. For many healthy seniors, those are smarter, gentler choices. According to the American College of Physicians, routine colonoscopies in adults over 75 without symptoms or a history of colon cancer may offer little benefit and may lead to more harm than good. But here's what matters most. After 60, healthcare should respect your wisdom, not just your records. You've earned the right to ask, will this truly improve my life? Because real health isn't measured by the number of tests you take. It's measured by how fully and freely you live each day, on your terms. The heart test that breaks more than it helps for many seniors over 60. The heart feels sacred. It is the rhythm of life. The one thing you do not want to fail. So when your doctor recommends a cardiac stress test, you may feel relieved, better safe than sorry, right? But here is the catch. Stress tests after 70 often reveal problems that are not actually problems. Slight changes in heart rhythm, stiff arteries, or a little plaque are normal in aging. These normal signs can look alarming on a test, triggering a cascade of follow-ups. Recall Harold, 76 years old, no symptoms, just a routine check. If his stress test led to a catheterization and then a stent soon after, he developed internal bleeding from the blood thinners. 3 months in recovery, all from a test he never needed. If you are not having chest pain, fatigue, or shortness of breath, it is okay to ask, is this test truly for me? Because the best way to care for your heart after 60 may simply be to keep walking, breathing, and living without fear. The emotional weight of overdiagnosis. After 60, your biggest health burden might not be disease, might be the fear of one. Today many seniors are living not with illness, but with worry born from a single word on a screen. Overdiagnosis is when doctors find something that is not dangerous. A spot, a shadow, a nodule. These may never cause symptoms or harm, but once labeled, they change how you see yourself, from healthy to uncertain, from confident to cautious. I remember Ellen, age 77, happy, independent, danced every week at the community center. Then came a scan. It showed a tiny growth on her lung, harmless and stable. But the word lesion kept her up at night. She stopped dancing, stopped laughing, stopped living fully. Seniors deserve freedom, not fear. After 60, your quality of life matters as much as longevity. Doctors who speak clearly, not dramatically. And remember, not every finding deserves your focus. The cost of being too careful. After 60, many seniors are told to be cautious, to test more, to scan more, to follow every what if. But what if that caution becomes the very thing that steals your peace? Have seen it too many times. A senior woman in her 70s gets a scan that leads to another test, then a biopsy, then a procedure, not because she felt sick, but because someone saw something and said we should not ignore it. Financial. The emotional toll is deeper. Seniors miss holidays, miss outings, miss sleep, all chasing a result that may never change their life. In this season of life, health is not just the absence of disease, it is the presence of clarity, comfort, and connection. Being careful, wise, but being too careful can cost you time, energy, and joy. Choose care that gives you back your life, and not care that takes it away. If you have stayed with me this far, I want to thank you. You are not just watching a video, you are taking ownership of your health and your peace of mind. Let us remember the 5 truths we uncovered today. Full body scans may find things that never needed fixing. Routine colonoscopies can bring more risk than reward. After 70, cardiac stress tests might trigger unnecessary surgeries. In a steady heart, overdiagnosis turns healthy seniors into anxious patients, and being too careful can quietly rob you of time, energy, and joy. Lesson here is not to reject medicine, it is to embrace it more wisely. As a senior over 60, your body carries decades of strength, resilience, and stories. You deserve care that listens before it scans, that respects your quality of life, and not just the possibility of disease. Your doctor, not just what this test looks for, but how it will help you live better. Ask, what will happen if you do nothing? That question alone can save you from months of stress and procedure. 60, you are not fragile, you are experienced. The best care is the kind that helps you live freely with clarity and dignity. You have earned the right to choose peace over panic, the right to live your years on your terms, not just longer, but better. Thank you for being here, and thank you for trusting your life enough to ask